Hello, Dr. Lewis here, your medical scientist and founder of Health Revival Partners, which is a chronic disease prevention and reversal program. And also, I'm the Chief Science Officer for GoMD, which is a really robust telehealth platform that anybody today should consider joining to get expert help without coming to a doctor's office when that's a viable option. So let's look at the coronavirus and when to see a doctor, looking at mainly CDC guidance and some other information that may help you understand symptoms and when you might need medical help. So this is from the CDC, what to do if you're sick. Call your doctor if you think you've been exposed to COVID-19 and develop a fever and symptoms such as cough, difficulty breathing, and follow these steps. The main thing we're doing here is to prevent the spread of the contagion, prevent transmission. Stay at home, stay in touch with your doctor, avoid public transportation. And your doctor is really going to make the call for you as to do you need to come in and see him or her and what to do in the process of coming in for the visit. But the main thing is we need to prevent contagion. And so here's our list. If you're positive versus negative and you've been tested, but if you haven't been tested, assume positivity and follow these instructions, which pretty much overlap with negative. We're all trying to prevent the spread of this. Stay at home, separate yourself from others, cover coughs and sneezes, clean and wash your hands thoroughly and often, avoid sharing personal items, clean all high-touch surfaces every day, including do your laundry regularly at a high temperature. Monitor your symptoms. Know the differences between a flu, cold, and COVID-19, which we'll cover in a separate video. Call ahead before visiting your doctor. And if you are with symptoms or think you've been exposed, wear a face mask. And ask your healthcare provider to contact the health department so that the healthcare department can gather information and offer really good statistics on how people are affected by this, and we'll have a better understanding of the disease and be able to take better action now and in the future. So call ahead. Let the doctor make the call. Wear a face mask. If you're caring for others, if they cannot wear a face mask because they're having respiratory issues, for example, then you should be wearing the face mask, even if you're presumed negative for the virus. So what to do if you're sick? If you develop emergency warning signs, get medical attention immediately. Of course, call in, but then head to the doctor per instruction. And those symptoms, difficulty breathing or shortness of breath, persistent pain or pressure in the chest, confusion or despondency, bluish lips or bluish face. And these are pretty far along in terms of symptoms. And I don't think the CDC is looking at all the possibilities. So we have this list that we got from this website. The most common symptoms for people who are positive with the coronavirus is a fever. And it may not come on for a while, and it may be short-lived, but fever is a significant concern. Dry cough, fatigue, production, even though we say sometimes there's a dry cough, sometimes there's a productive cough. Shortness of breath, muscle pain, so on and so forth. Sore throat, headache, chills, nausea, vomit. These are somewhat overlapping with flu symptoms, including diarrhea. So be aware of all these potential symptoms. There's a very clear correlation between underlying health conditions, mortality, and the severity of the disease if you're unfortunate enough to be exposed to the SARS-CoV-2 virus and come down with COVID-19, the actual disease. So you can see people with underlying cardiovascular disease have a significantly higher mortality rate than people with no underlying health conditions. And this difference in mortality, and probably tracks very well with severity of conditions as well, is a 1,200% increase in death. And the treatments are looking fairly promising, but keep in mind the current flu vaccine shot is only 58% effective at controlling the flu. So really, your best prevention and your best treatment against very severe conditions of COVID-19 is your own personal health. So that's it for today. When to see a doctor. Obviously, your doctor is going to make the call. Be in contact with him or her and follow their instructions. We're being discouraged from just showing up in a doctor's office because we're trying to prevent the contagion. So make the call first. Let the doctor make the call as to whether to come in and where to go. This is Dr. Tom Lewis with Health Revival Partners and GoMD, and I hope you found this information helpful. Thank you very much. Bye now.